We're back with a warning now about the Ebola outbreak in Central Africa. The World Health Organization is calling it a public health emergency of international concern. Now, that's below the level of pandemic. The death toll is now 131. 531 more people have become sick. That's according to the Congolese Health Ministry. One of those patients is an American doctor now being treated in Germany. News 4's Aimee is working for your health. She spoke with a local infectious disease expert about what you need to know.
With case numbers now in the hundreds in Central Africa, here's what we know about the Ebola Bundibugyo virus. It spreads through bodily fluids and often starts with a fever, headache, and sore throat, then progresses to vomiting, diarrhea, and bleeding. It has a 25 to 40% mortality rate, and there is currently no vaccine or treatment.
The scary part is that it emerged without being detected and obviously spread for some time before health authorities were aware of it.
Infectious disease expert Julie Fisher says right now there's no need for people in the U.S. to panic, and that Ebola is harder to spread than COVID because it's not airborne.
So it's a very different outbreak than COVID-19. The risks are very different, and it's not a parallel situation. Most people in the U.S. are not at any high risk of being exposed.
One factor health officials have to consider: where they would put American Ebola patients if the need arises. That's because dozens of national quarantine beds are currently taken by patients being monitored for hantavirus.
Right now, what looks like is happening is a bit of an assessment, a scramble to figure out where we might house people who were infected with Ebola if they are U.S. citizens come back to the U.S.
Back in 2014, Dallas nurse Nina Pham got Ebola after treating a patient for it. She was flown here to Frederick, Maryland, and then taken by ambulance to NIH for treatment and later recovered. 12 years later, this latest Ebola outbreak comes amid a changing global health landscape. The Trump administration has now pulled the U.S. out of the World Health Organization, accusing it of mishandling the COVID pandemic. The Trump administration also shut down the U.S. Agency for International Development, or USAID, which helped respond to global health challenges.
You've practiced the play over and over again, and then it turns out that the quarterback isn't on the field when the actual game starts. There's more uncertainty and potentially less ability to mobilize an effective response.
The State Department is now urging Americans not to travel to Congo, South Sudan, or Uganda as health officials around the world work to contain the spread of Ebola. Aimee, News 4.
Now, in a statement to NBC News, the State Department said it is working with partners in providing funding and support to combat Ebola. The spokesman also said, quote, "It is false to claim that the USAID reform has negatively impacted our ability to respond to Ebola. In fact, by bringing USAID global health functions under the new Bureau of Global Health Security and Diplomacy Bureau at the State Department, our efforts are more aligned and effective," end quote.